Hello everyone, how are you this evening? Obviously you all know me. I'm Anthony, your son-in-law, brother-in-law. I'm here to speak to you about a subject that is really close to my heart. It's about TOF, tetralogy of Fallot. My son has it. What is TOF? According to CDC, Center for Disease Control, congenital heart defects, about 40,000 births per year in the U.S. My son is living proof that he is part of that 1% born with a CHT called TOF. I feel qualified to speak to you all this evening about TOF because my son has the condition. And I have learned everything I know about it from the doctors. I am here to inform you about TOF. Today I want to explain to you what TOF is, what causes it, and how it is repaired. TOF involves 4 heart defects that make the heart work much harder than a normal heart like ours. My son's heart, who I discussed earlier, has a huge hole in between the heart's 2 lower chambers, which is one of the 4 defects. There was narrowing of his pulmonary valve, which is another one of the defects. His heart muscle is thicker than usual, and it causes the right side of his heart to work harder than another one of the defects. The last defect is due to the aorta. It is in between the left and right ventricles. It causes oxygen poor blood from the right side of the heart to flow directly into the aorta instead of into the pulmonary artery. The doctors often don't know what causes TOF, which is my son's case. Doctors have noticed some factors happen during pregnancy, and they include poor nutrition, German measles, and some other viral illnesses. Alcohol, age can be a factor, diabetes, and sometimes it can be hereditary. TOF can be repaired and managed. TOF is repaired with open heart surgery or multiple open heart surgeries. During surgery, surgeons will patch holes and hopefully repair the valves. Sometimes the surgery is right after birth. If it's not a major problem, doctors like to wait till 6 months after birth. So I guess so their heart gets big enough for the surgery so they can try and save the valve. Waiting for surgery was a very tough time in our lives because all of us know that Carson went through that 7 to 10 hour surgery, and he's obviously doing a good job. It was a hard time in our lives. We were on edge hoping our son would be okay, waiting. We are definitely glad for the wait because the surgeon saved his valve. If he didn't save his valve, he would have to put a temporary valve in, and at 10 years old, they would have to replace it. Since they saved it, he will never have to have another open heart surgery.
Yay.
The surgeon told us saving the valve is rare. Doctors are working on creating a replacement valve that will grow with the patient and last around 10 years. Won't that be amazing? TOF is managed by having regular checkups with a heart doctor. During the visits, the doctors will check him and put a echo on him and make sure his heart is okay. I hope my speech informed you more about TOF. I hope my speech informed you more about TOF, what causes it, how it is repaired. As I stated earlier, my son was diagnosed with TOF after birth, and I have learned a lot of information from the doctors. Tetralogy of Fallot is not common, but it occurs in about 5 out of every 10,000 babies. All of the causes I explained do not relate to me or my wife. We still had a baby with TOF. Babies and children with TOF have episodes that you can see. They'll have a bluish tint to their face, their lips, and their skin, fingernails, and it occurs because their oxygen levels are very low. Have a good evening.